Stroke in COVID-19. In hospitalized patients, the incidence of ischemic stroke associated with COVID-19 has varied from 0.4 to 2.7%, with intracranial bleeding ranging from 0.2 to 0.9%, and cerebral vein thrombosis about 8.8%. The risk of stroke depends on the severity of COVID-19. The risk increases when the patient is admitted to ICU following serious illness. Stroke usually occurs 1 to 3 weeks after symptoms of COVID-19 begin, and it might be the first symptom that leads to hospitalization. Let us discuss the risk factors and mechanisms. We have to keep in mind the classic stroke risk factors such as older age, hypertension, hyperlipidemia, atrial fibrillation, or diabetes mellitus, which have also been found in patients with COVID-19. There are two main risk factors of stroke in COVID-19 patients. The first is hypercoagulation, and the second is infection-related pro-inflammatory condition. There are different stroke pathways associated with COVID-19. One significant mechanism appears to be thrombophilia linked with the virus or the immunological response to the host, as increased markers for hypercoagulability and inflammation. COVID-19 is frequently associated with an abnormally high coagulation risk. This is reflected in the extremely elevated D-dimer levels, a marker of clot turnover, observed in many patients over the course of the first few weeks of disease, particularly those who are more severely affected. Elevated D-dimer levels were also presented in some patients with ischemic stroke. It has been discovered that thrombosis is present in the large vessels such as the aorta, carotid, and basilar arteries, resulting in ischemic stroke. Cardioembolism is the next risk factor. There is the possibility that cardiac dysfunction directly related to SARS-CoV-2 infection may also be a factor in the development of embolic strokes due to SARS-CoV-2 myocarditis. Another mechanism may be due to cardiac damage and dysfunction associated with general critical illness. Cardiac symptoms such as arrhythmia, heart failure, and myocardial infarction have all been reported in association with COVID-19 patients, consequently predisposing individuals to cardioembolic stroke. COVID-19 patients can have not only ischemic stroke but also hemorrhagic stroke. Moderate and severe symptoms require the use of anticoagulants for the prevention or treatment of thrombosis in COVID-19 patients, thus will increase the risk of hemorrhagic stroke. An extensive ischemic stroke may also cause hemorrhagic infarction. If you find this video helpful, please hit the subscribe and bell buttons. And don't forget to like and share this video. Thanks.